School boards across Ontario have begun suspending some of the thousands of students who aren't fully vaccinated. The province is currently dealing with its worst measles outbreak in decades, with the spread mainly among unvaccinated children. Marianne Demain is tracking this story for us. So, Marianne, tell us more about these suspensions.
Yeah, this round of suspensions targets high school students in Ontario at all of Ontario's publicly funded school boards. As we know, the latest numbers as of April 2nd, according to Public Health Ontario, is that there are 665 cases of the measles right now. And so thousands of high school students in Ontario now facing suspensions if they're not fully vaccinated, because as you heard Chris just mention, majority of the cases here in Ontario are among unvaccinated kids. Now, measles, the vaccine specifically, is one of the mandatory vaccines in Canada schools. And so you have to get your first dose when you're 12 months, the second dose at around 18 months. And so anyone who has not had those two doses, you're considered unvaccinated. So in Toronto, about 10,000 students are considered not fully vaccinated, and we know that the recent numbers is that close to 600 students have already been given suspension orders in Toronto. Now, in order to get out of this 20-day suspension, you have to either get vaccinated and bring those vaccinations up to date, or provide a valid exemption and proof of that valid exemption as well. Here's more from Toronto's Associate Medical Officer of Health.
Among high school students, they have the lowest rates of vaccination. And one big reason for that is they were in grade 7 during the pandemic, and we did not have school-based vaccinations for them because of the pandemic. And so many of them missed a really crucial meningococcal vaccination, which prevents meningitis, that would otherwise have been given in grade 7. They might have also missed their teenage booster because of the pandemic. And so that's why we chose that cohort for this year.
So that's in Toronto. In Ottawa, we know that about 1,500 students were identified as not having up-to-date vaccinations when it comes to the measles specifically. And suspensions happened there in March, and they continue. In Waterloo, for instance, about 1,600 students were given suspension orders last week. Looking at the measles in general, though, we've been talking about this a lot, Chris. We know that the measles was actually eradicated in 1998 because of the high vaccination rates. But those vaccination rates are going down, and that's why we're talking about this. That's why it's still spreading in the community.
Right, and impacting so many school-aged children. I know that now it's prompting some renewed calls for the province of Ontario to digitize its vaccine registry. What's the latest with that? Yeah,
because here in Ontario, we have that yellow paper. All of our vaccine information still recorded on paper. It's not an electronic immunization system. And so there have been calls for health officials here in Ontario to make that all electronic. It would not only make it easier for students and families to keep track of what vaccines their children have, but perhaps stay on top of them if they're not up to date. So that's one thing. But in the meantime, Ontario is dealing with this high number of measles cases, and that's actually prompted the health department in New York State to issue a travel advisory for anyone coming to Canada, specifically Ontario. You see that there, the highlighted portion there saying measles is a car ride away. That's a warning for everyone in New York, telling residents that if they're coming to Canada or Ontario specifically, make sure you're vaccinated or have your vaccines up to date.
Interesting warning. All right. Marianne, thank you very much.
You're welcome.